Hello and welcome to today's webinar. I'm Kelly Nicoll. I am President of IOSH and I am so pleased to introduce you and welcome you to our first webinar in our mental health webinar series. Most of you are going to know what IOSH is about, but for the benefit of any of you that are unaware or unfamiliar with us, we are the Institution of Occupational Safety and Health, and we are the largest professional body for OSH in the world. We qualify new entrants into the profession, and we exist as a charity for the public good, protecting workers through good safety and health at work. All of our work pursues to our long-standing vision of a safe and healthy world of work for everyone, no matter where they are in the world. So today we are going to be looking at stress and burnout in the workplace and what it means to be a bit more proactive rather than reactive in the workplace setting. I am really pleased to be able to introduce Karl Bennett, who is joining us today. He's chair of the EAPA, the Employee Assistance Professionals Association. UK EAPA is a non-profit organisation and represents the interests of individuals and organisations concerned with employee assistance, psychological health and wellbeing here in the UK. Karl is going to give a short presentation and then we'll move on to a discussion. Karl, over to you.
Thanks, Kelly. That's a lovely introduction. I'll ask you to do that again if we can some other time. Yeah, thank you, and lovely to be here. I'm really pleased to be able to talk with all the members of IOSH. This is something that I do on behalf of EAPA quite regularly, really to talk about how EAPs impact the health and well-being of people within organisations, and obviously within the world of occupational safety, then mental health, anxiety and pressure definitely fit within those categories. Before I get started, what I normally do at this stage is to ask people what they think might be the kind of top 5 most stressful jobs in the world, really. And we ask for a show of hands. You know, do you think it's the police, firefighters, welfare officers or social workers, teachers, commercial airline pilots, HR professionals, nursing, doctors, healthcare professionals? And we normally see lots of people putting their hands up for most of the things that I say, but the one that gives the most definite response is commercial airline pilot. What could be more stressful than taking 500 people 30,000 feet in the air at hundreds of miles an hour, making sure you get them there safely? Particularly with all the other concerns around weather and things like that they have to take into account for. So it's surprising to hear that actually commercial airline pilots don't sit in the top 5 most stressful jobs at all. In actual fact, they don't fit in the top 10 or the top 20 or the top 50 of most stressful jobs. The others that I mentioned, they're in there. So the police, firefighters, teachers, welfare officers, the nursing profession and HR professionals actually all sit within the most stressful jobs within the world. So why aren't commercial pilots there? And it was one of those things that really kind of confused me. I'm thinking, well, surely it must be. And then I started reading information about the stress that pilots are placed under, and find that 72% of retired commercial airline pilots said that they were impacted by stress that affected their ability to do their roles. 72%. Yet they don't even fit in the top 5, top 20 or top 50 most stressful jobs. Why can that be? And then I found out, because what I did was actually became a pilot myself, not a posh, flash commercial airline pilot, just a normal pilot that flies little planes. But we go through the same processes, which is in order to be able to fly an aeroplane, you need to have certain things in place. Obviously, you need a license, but you also need a medical certificate. And that medical certificate needs to say that you are medically fit to be able to fly. So no medical certificate, no pilot's license, no ability to fly. And I thought to myself, well, maybe I'm not going to pass the medical, so I'll go and see the Civil Aviation Authority doctor to start with before I even do my license, just to make sure that I'm going to be okay, because it's a lot of time, a lot of effort, and a lot of money to become a pilot. So let's make sure I get the practical stuff out the way first. And when I sat down with the doctor, they were very good. They passed me. They said, you've got no problems. You'll be fine. And then I said, that's brilliant. I was really worried about it. I said, I've had a headache all day because of this. And they said, do you suffer with headaches? And I said, actually, I do. I take tablets for migraines that I get. And all of a sudden, things started to change. The atmosphere became a little heavy inside the doctor's room. And they started questioning why I got headaches. Was it stress related? What were things like at home? What were things like at work? Were there any particular things I was going through that might cause some anxiety or worry? And I said, no, it just migraines that I get. And what they said was, we cannot pass you if there is any possibility that your headaches are affected by mental health or stress-related issues. No medical pass, no license, no flying. Now, for me, that wouldn't have been the end of the world, because my job didn't rely on it. I wasn't somebody that had to have these things in place to be able to earn an income to live. But I did think to myself, imagine if I was a commercial pilot who relied on these things, and if I was to mention anything that might indicate I have some mental health or some stress-related issues, I'm not going to be able to do my job. Fortunately, I was able to find out what the headaches were. It was caffeine, actually, and I stopped drinking caffeine completely. And the headache stopped, meant I didn't need to take tablets, and I was passed and able to continue flying. But what if I relied on it? What if I mentioned I had a mental health issue now or in the past? Well, the fact is, I'm not going to mention anything, because if I did, I wouldn't be able to do my job. And it suddenly occurred to me, that's around the ability to talk safely within your workplace about the things that are impacting you, particularly around mental health. So no wonder commercial airline pilots, even though it seems like it's one of the most stressful jobs in the world, 72% of retired commercial airline pilots say that they are affected by stress that might impact their job. No wonder they don't fit in the top 5 most stressful jobs, because nobody's saying anything about the stress that they are experiencing. And I took that to the world of work, really, when I started doing the work that I do with EAPA and EAPs in general, which is making sure that organizations provide a safe place where people can talk about the issues that are impacting them without worrying of the effect or impact of doing so. And we know that there are stresses, there are anxieties, there are worries and stigmas attached to mental health. But if you're not talking about it in the workplace, then how on earth can your workplace do anything about it? So what I'd like to do, if that's okay with you, is talk about EAPs. And the reason I want to talk about EAPs is because if you have an EAP, an employee assistance program within your organization, then you'll probably think that it's there to support people that are experiencing stress or worry or anxiety or whatever it might be, and you refer people to the EAP when they need it. So let's just talk a little bit about the history of EAPs. First things first, and this is always really interesting. Did you know that the first EAP happened in 1917. I wasn't there. It wasn't my EAP, I can promise you. But it was actually Macy's in New York that had the first EAP. And it was aimed to heal what they saw as an ill society beset by alcohol-related problems such as alcoholism, family violence, and saloon-based political corruption. So that's what they thought EAPs were needed for. But then, of course, we had the Great Depression. where occupational alcohol problems were brought into place, because that was during the war. The female women used to get involved in work much more than men during the war, because the men were off fighting, and the women were doing everything else. And within workplaces, occupational programs were there to support people around things that might be impacting them. And it was the first time that depression and anxiety were included in one of the supports that employers gave to their employees back in 1940. Then, of course, other things happened. 1970, we had the UK recession. 1980, we had the financial crash. And then everything else changed in 2002, because before then, EAPs had always been put in place to support issues that were sort of reactive based. So there were problems, and EAPs were put in place to support those issues. Whereas in 2002, there was a case between Sutherland and Hutton, and the judge that was involved in that, Lady Justice Hale, said that an employer who offers a confidential advice service with a referral to an appropriate counselling or treatment service is unlikely to be found in breach of duty. That meant from 2002, organisations weren't just putting EAPs in place to support with reactive issues. They were putting EAPs in place as an insurance. If we have an EAP in place, somebody's ill or takes their own life or whatever it might be, then we can say, well, we had the EAP in place. So as the judge says, we are unlikely to be found in breach of duty. And it just exploded. EAPs were everywhere. It's about this time that I was involved in EAPs for the first time, actually. And what we saw was EAPs were there for a few organizations. Then that case happened and the phones rang off the hook. Every single organization wanted one. The thing to remember there, though, is they didn't really care about what it did or how it helped. They needed it just to make sure that their duty of care wouldn't be questioned if anything happened. Fast forward to 2024 or 2000, I would say 2025. I haven't got that wrong, but we did this. We did the survey for this to find out how many people were using EAPs in 2024, and over 1 million clients. 90% of UK businesses have EAPs, and over 1 million of their employees use the services annually. And that's an incredible amount of people that are using EAPs. Some of the common misconceptions with EAPs is that high usage is a positive indicator of wellness. We had this, Kelly, at the last session that we did. We were on stage and somebody said, how do I get more of my employees using the EAP? And I said, well, that's easy. Just treat them really poorly. Because if you treat employees really poorly, the likelihood is that they're going to need to speak to a counsellor. And that really highlights the fact that high usage is not an indicator of a well workforce. In actual fact, I'd say the opposite. High usage of an EAP is an indicator of a workforce that has poor mental health or isn't being supported by their organization. Another misconception is that they support all mental health issues. That's not true, but it is the brush that we have been we've been painted with. The EAPs do everything. It doesn't matter whether you have serious mental health issues, psychological issues, childhood trauma, or anything that deals with mental health issue. The EAP will sort it out. That isn't true. EAPs were always in place to do two things. That is, support people back into the workplace or help them remain in the workplace if they're experiencing workplace or home-based anxiety or worry. Depression isn't normally something that's supported by EAPs. It is now. And in fact, EAPs do a lot more, but they're being forced to do those things simply because they're being asked to do them by the customers that they're working with. Remember that a good EAP is an EAP that you can be sure your employees are able to pick the phone up and access a counsellor straight away when they need it, and maybe just get support in the moment. Because that's how EAPs should be being used. If you're experiencing some trauma or some worry, if you've had an argument with a partner, or maybe you've got an issue with somebody at work, pick up the phone and speak with a counsellor. But don't expect them to put you through for sessions of counselling, because sometimes that's not the most appropriate thing to do. Which leads us to the next one, which is that clients have the right to 6 sessions of counselling. Sometimes counselling is appropriate. And 6 sessions of counselling is the number of sessions that NICE guidelines say is appropriate for solution-focused support, which is what EAPs provide. So it is available when it's needed, but it isn't always appropriate. Sometimes the things that cause people the most anxiety is a lack of control around a situation. So if a conversation with a counsellor can give you back some of that control that you feel that you've lost, that's all you need. So picking up the phone with the expectation that you're going to get 6 sessions for something that you might not need counselling around is something that's worthwhile thinking about when you speak to somebody. Somebody once said to me during a session that I was listening to for the work that we do as far as quality is concerned. They were saying that they wanted support for a financial issue that they were going through. And the counsellor was saying, well, what I'd like to do is refer you through to a financial support service, something like a pay plan or step change. And they said, no, I want counselling. I'm really worried about this. I'm losing sleep. I'm arguing with my family. And the counsellor said the most amazing thing, which is, I can put you through to counselling if you like, around the financial issues that you've called us with. At the end of those sessions, you might feel better about your debt, but you are still going to have that debt. So sometimes signposting is the best support that you can offer to anybody. It's why mental health first aiders work really well within organisations. Another issue is that GPs can refer all patients into their EAP service. They do, but they shouldn't. There is an NHS service that supports people fantastically. EAPs are work-based counselling services. They're employee assistance programs, not there just to support the whole of the NHS. EAPs are not confidential. This is a new one that we're hearing quite a lot of, because there's a lot of news stories, particularly on the BBC at the moment, about the support that's being provided by EAPs and their lack of confidentiality. I can assure you that everything that is said to an EAP is entirely confidential. The minute you engage in a conversation with a counsellor, that information is confidential. 3 exceptional circumstances that would be broken is if that you threaten the life of somebody else, if there is a child protection or vulnerable adult issue, or if there's a threat to the security of an organisation, data or structural, then the counsellor will say, I need to break confidentiality. Everything else is completely confidential between you and the counsellor. The other thing is that employees understand how they work and when to use them. That's not true either. That's why I'm going to talk to you very quickly in a moment about the split between EAPs and wellbeing in general. EAPs have been put under the umbrella of wellbeing, and they now feel that they support with everything. And they feel that because they can, and customers or employers feel, because they have an EAP in place, they can say to their employees, if you need an EAP, pick up the phone and speak to them. If you've got a well-being issue, if you've got a mental health issue, doesn't matter what it is. If you've got issues around menopause or debt or violence within the workplace or at home, pick up the phone and speak to the EAP. That isn't the right way to use EAP. Some of the things I've spoken about already hopefully highlight how EAPs can support people. And what I would say is, please keep your employees up to date around how they use their EAP and why they should be using them. Because the more information your employees have around how they might use their EAP, the more likely they are to use them in the correct way. And the last one I've already said, which is the only wellbeing product needed for employees. That isn't true. EAPs are there as a reactive support that's needed for employees. There's a whole set of services that should be considered as well as EAPs in order to support the well-being of your workforce. Very quickly, I'd just like to go through this, and I promise you this is the end before I hand back over to Kelly. He's probably thinking, Karl, we were only going to speak for 5 minutes. Let's look at this, and this is an employee graph, for example. So on the one side, we have employee well-being, their well-being being 0 at the bottom and 10 at the top. And normally when an employee starts within an organization, they're at 10. They're excited, they're enthused, everything you give to them, they want to do. It's probably the time where you need to be most careful for them with regards to health and safety as well, because those are the times that they want to do everything without actually knowing what they should be doing. And then over time, what happens, unfortunately, is employees start to become unwell. And they become unwell emotionally, or they experience some anxiety or depression or worry because of lots of different things that happen at home or things that happen at work. I'm very aware that it's not linear like this. People aren't well and then they're unwell over a particular period of time. For some people, this doesn't happen, but for many people, this is the case. In reality, this is the way that people start to feel that their well-being or that their emotional wellness starts to be impacted over time. But let's stick like this for a moment, just because it's easier. And I couldn't do a triangle with those waves in. So it's a practical thing for me, if you like. So what happens during this, in order to support this decline in employees' well-being, is that organizations bring in reactive or crisis-led support services and interventions. They are things like EAPs. There are also things like financial or legal advice services for people that might need grants, or they might need support around debt that they're experiencing. Maybe it's alcohol-based issues to support around alcohol or substance abuse, which has always been what EAPs are there to support. And actually, I think it's happening more and more. But there's a lot of money that is spent by organizations to put in this reactive support. However, the way they're used, or the way that they're promoted, is if you ever need support for anything, please call. Please access this service, which means the only time they access them is there, right at the bottom, when they're starting to feel that they can't cope with the issues that they might be experiencing. And funnily enough, what happens at that time is employees start to recognize that somebody isn't feeling very well. So then they talk about all the things that are available within that organization. So, you know, have you considered this or that, or have you spoken with your manager, whatever it might be. But it's here that they're starting to engage with their employees around the things that might cause them worry, anxiety, depression, or whatever it might be. My question to you as employers and employers generally is, what are you doing here? Because there's a whole bunch of time that you've got between the time that that employee is really motivated, doing all the things that you would want them to do and that they want to do. They're being proactive, they're being productive within the workforce, they're engaging with everybody. And on that slow decline, you start to see absenteeism, you start to see conflict within the workplace, you start to see all the things that somebody might demonstrate with poor mental health. But you're not really doing anything because there's no need. You've invested all your money into the reactive support that's available when they need it, because that's where the cost is. And because well-being includes EAP and only EAP services. So when it does come to putting in well-being services, the proactive, preventative well-being services, we spend as organizations just a little bit of money. All our investment goes into those reactive services that are there to support people when they feel unwell. And that's a really interesting point. And we have it quite regularly where I'll work with organizations and they'll say, we've got a really great product, but we can't get that supports people proactively, but we can't get it into the organization because they're saying their budget is being used up with their EAP or their reactive based services. And you think, well, that's crazy. So what tends to happen is those organizations will plug their services into the EAP, which increases the cost of the EAP, but doesn't actually mean that the EAP is providing anything particularly different. And when they're not being able to, when they're not plugging those services in from organizational experts, EAPs are trying to become experts themselves. So when organizations are saying, can you provide us with financial support? EAPs will say, okay, well, we need to learn a little bit about how we offer financial advice, or we need menopause support. Okay, well, we need to build some menopause programs. All of these things are things that EAPs are having to become, because organizations generally aren't separating proactive wellbeing services from the reactive services that EAPs are part of. When we look at reactive services, I've mentioned this already, it tends to be proactive EAP. So if you need support, pick up the phone, speak with a counsellor. It might be emergency services, and those emergency services are things like I say, hardship loans, grants, maybe resources being put in place for unexpected financial crisis, or substance or alcohol abuse support and education, I would say, other things that are put in there. So those are the reactive things that employers spend loads of money on to make sure that their duty of care is covered if anybody else should say that they weren't supported. Let's look at the proactive stuff, because there's a load of things that you can do proactively to support your employees. Maybe health and fitness programs. That's things like giving people access to gyms, or maybe you've got on-site fitness services. Healthcare benefits, things like comprehensive health insurance, maybe dental or eye care, maybe preventative health screenings, cholesterol, blood pressure checks, things like that. Maybe flu vaccinations are something that organizations do to ensure that their people are kept well. There's nutrition support, healthy snacks, meal options, maybe counseling, maybe coaching around nutrition or educational programs. Coaching itself is a really big thing that employers are asking for at the moment. That might be around coaching for performance or careers coaching, management coaching, financial coaching. These services are proactive things that will stop people, hopefully, reaching that point of crisis where they need to speak with a counsellor. Mental health resources. So any EAP service will have things that are available for you to access that will mean somebody can get articles or webinars or documents that they're able to read if they're experiencing mental health issues. Again, those things are changing slightly. So what we're seeing much more of in the market now is organizations providing hyper-personalized applications. So you would go on to an app or a resource that has mental health applications, and rather than just scouring that app or that website for the things that you think you might need, you're asked questions that actually will present the things that are going to support you the most. And then drugs awareness, as we've already spoken about. So lots of proactive things, but there's more. Don't worry, I won't go through these in detail. There's flexible working arrangements, there's workplace support, diversity, equality and inclusion initiatives, recognition programs, things like flexible benefits that might include things like reward and recognition. Those reward and recognition apps at the moment are fantastic. I demonstrated one to a person I was speaking with yesterday, and they're like, how does it work? It's really simple. You kind of go on, you pick the person that you want to say you did a really good job, and this is just in a colleague to colleague, not manager to one of their team, just colleague to colleague. Thanks for your help. That was really appreciated. And everybody within the business sees it. That person feels recognized. And when you think about organizational culture, that's really important. As career development, there's workload management. And what I mean by that is making sure that managers are having one-to-ones with their workforce, making sure that they're actually aware of what's impacting them within their workplace. And then, of course, opportunities for growth. All of these things fit into 4 pillars of well-being. So when you're thinking about how you support your people with their well-being, think about the things, and this is proactive well-being, remember, not just the reactive stuff. But when you're thinking about proactively supporting your employees, is the things that you're bringing in, are they looking after the emotional well-being, the physical well-being, the financial well-being, and importantly, the community well-being of that employee? And what I mean by that is, do they feel like they belong? Because if they feel like they belong within an organization, if they feel safe and valued within that organization, then they will talk about the things that are impacting them. Childcare and elder care are big things that are starting to resonate with employees right now. We're in a sandwich generation. I did an article that's in Personnel Today, I think, that talks about the sandwich generation. People are having children later, which means their responsibilities for caring for children are coming later. It means that their parents are they're supporting their parents at the same time that they're looking after children. But employers, while they'll recognize that people might have responsibilities for children, because we see photos on people's desks or on their screensavers of their child's first day at school, we don't really see the parents' first day at the dementia clinic. So it's a hidden thing that people, the organizations don't know about. So feeling like somebody can talk about the things that are causing them worry or anxiety, causing them some worry or whatever it might be, is really important. And organizational culture is one of those things that can help with that. Things that you can do to become a more proactive employer, as we know the issues that you're fixing. Don't try and fix everything. At the beginning of the COVID pandemic, employers panicked. And they put everything in. If it had well-being written on it, they'd bring it in. That included flower arranging, that included yoga, that included you name it, they'd put it in. And that's good, that's great that organizations were doing that. But what they've got now is a huge amount of well-being services that don't actually have any add any value to somebody's well-being. The things that we've spoken about just then hopefully mean that you're actually putting in services that support the well-being of your employee group, but you've got to know what they are. Talk to them, talk to your managers about the reviews that they're having, the one-to-one reviews that they're having. Make sure that the data that those managers are collecting from the one-to-ones are fed through to a central area where you can identify themes and trends that might be impacting your workforce, particularly within the construction community, for example, that often work away from home. They're not in the workplace. You don't know what's going on within those environments. Often a male-dominated environment as well. It's very difficult to get those people to talk. So make sure that your managers or your leaders, the people that are having the conversations with those people, ask the kind of human questions. Is everything okay? Anything we can help with? And if they're saying, yes, there is, I'd like this, make sure that's fed back. Because if you're seeing themes, if you're seeing trends, if you're seeing patterns in the things that you're getting back, then you as an organization can do something about it. But you've got to ask your employees to know what they are. Don't just assume you know what it is that you're trying to fix. As I've said, train your managers, make sure that the questions you're asking are consistent and use that data. Beware of tradition. What I would say by that is just because it's worked previously doesn't mean it's going to work this time. And the other thing is just because you want it as a leader doesn't mean it's going to work for everybody. Gyms is a great example for that. I'd love access to a gym. Let's give everybody gyms. It isn't necessarily something that's going to work for everybody, but with the data that we were talking about before, you will know the things that really resonate with your people. Make sure that they're aware of the services that are available to them. And lastly, but not least, lead loudly. Make sure that you as a leader are talking about the things, the practical things that are causing you issues. I had real issues getting the kids to school today, or there was an inset day, or my mum's had a fall and I need to be able to do that. And it means I've got this meeting and I couldn't do it. All of these things we recognize, but as a leader, we don't often say these things. My recommendation, please lead loudly. Talk with your workforce about the things that are causing you issues, because the more the more you normalize that, the easier it is for them to be able to talk about it themselves. I just pop that in there because it's my favorite photo. If you want to link in, please do that. Just take a photo of the dots in the bottom right-hand corner. It would be great to link in with you. And if I can help in any way, I'd love to be able to do that. Kelly, I'm aware that that was probably about 20 minutes longer than you wanted me to talk.
No, it's great. And apologies, I was on mute the whole time, but I think a lot of people could see me kind of nodding and smiling and giggling in the background. I am certainly, I was smiling at the EAP element. I used my EAP at work last year. My dad has a terminal cancer diagnosis, and actually in that moment of kind of, what does that mean? How do I deal with exactly how I'm feeling right now? I rang our EAP, and weirdly ended up speaking to a woman whose father had had a terminal diagnosis a few years ago, and actually it was incredibly beneficial. Counseling wasn't going to help, do you know, and it was very much that in that moment, like I needed that vent, I needed that ability to talk to somebody. Counseling wasn't going to help because, you know, it is what it is, and you know we deal with it on a daily basis and all of that kind of stuff. But it's really interesting how people have this expectation of their EAP being everything for everybody.
Yeah.
I am going to remind everybody, you know, if you want to ask Karl or I a question, please pop it in the Q&A. If you're feeling brave and want to join the conversation, you can raise your hand and we can get you unmuted. But I think what became very, very clear in that presentation, Karl, is that, you know, prevention is a hell of a lot better than cure. And I think we know this, don't we?
Yeah.
We know this as health and safety professionals. We know this within our own industries. So what are some of the most effective kind of proactive strategies you've seen, kind of particularly around kind of preventing stress and burnout in the workplace?
I think not waiting for it to happen is probably the most effective.
Yeah. Yes.
And yet they do. People,
Mm.
it's not a new thing either.
Mm.
It's been there for as long as we've had employees. We kind of wait for the issues to happen before we do anything about it. And how many times do employers say we need, when one occurrence of something happens, do they say we need to do something about that for everybody? The best strategy that any employer can take is making sure that their managers or the leaders within that organization are aware of the things that they need to be talking with their teams about, that they're given the equipment to be able to do that, the tools, if you like, to be able to have the conversation. So there should be kind of a common set of one-to-one questions. And it isn't, you know, people are different. You can't go into everybody and ask a list of questions and be very robotic about that, because it doesn't endear
help.
the manager
Yeah,
to anybody. Can I just ask, is everything okay at home? Is everything all right?
Is everything, yeah.
You can't do that. You have to give managers the ability to manage. But within that, there should be some, not mandated, but some really kind of genuinely suggested things that people need to ask of their workforce. And different industries will have different things that they need to know as well. I mentioned the construction industry, and the rail industry also is one of those things. So many years ago, we were the first people to bring EAPs into Network Rail. Now, Network Rail is or was then a male-dominated environment, particularly on the tracks, because they would work in gangs, and those gangs would go onto the tracks and they would do all the work that needed to be done. And they saw the most horrendous things, because people do the most horrendous things on railway lines. And it affected them. But these guys were all, you know, they're all tough, rugged men that, I know why I'm doing that. Doesn't make it tough or rugged.
Doesn't make it really more tough or rugged, but yeah. We're coming into Six Nations season. We're coming into rugby season for
That's not how I look. More like a tough, rugged Pepper the Pig more than anything else. But you know, those people are they're tough, they're out there, and they certainly don't talk about their mental health issues. And what we found was that we were training, we literally had a van, it was, that we went around the country and we spoke to all the locations where the gangs worked from. And we spoke with their managers about the conversations, or the supervisors within those teams, about communicating what it is that EAPs did, what it is that the way that mental health impacts people. And we kind of gave them the tools to have the conversations. And the biggest thing that we got from that was that people within the gangs, individuals within the gangs, would talk about the fact that they had used the service. So they might say, you know, it might be just in a tea break, somebody will say, you know, I had to ring that counselling service that day. And it's all kind of like, oh, I rang, it was very off the cuff. And actually, they were really good because what they said was this, this, and this. The minute somebody says something, it gives everybody else in that group permission to be able to A, have worries themselves, and B, pick up the phone and get help. And we saw the biggest shift in the support that we were able to provide to Network Rail simply by making sure that managers were having the right conversations with people and then empowering their people to talk about the issues that they might have had.
I think that's really interesting. And I think as well, if I can do a yes and, I think one of the things that we often do as people go into people management positions and we start managing teams, people do that because they've been there the longest or they've got the most technical knowledge, but we don't, if I can reflect, I think that sometimes what we don't necessarily do is we don't necessarily equip line managers to be able to have these kinds of conversations. I think we're certainly starting to, but if you, I don't know, I'll give you an example from a little while ago. I had a phone call from a member of staff who was in crisis, and then I was told that, and I helped them deal with that crisis in that moment and provided signposting, etc. And was then told by somebody else that actually they were going to be dealing with it, and if that individual contacted me again, that I was to signpost them over to this individual. And I was like, no. Number one, they've reached out to me because obviously they trust me, or there's a level of trust in there. And secondly, I know that individual does not like that individual and will never go to them. Yeah. And I think often what the bit that is missed is we can do it with peer support, and peer support can be wonderfully effective and proactive. But getting line managers to ask those kind of questions, and we have lovely campaigns like Ask Twice, and get comfortable in following up and leading loudly, which I am very much trying to do, because I think it's vitally important that we are comfortable with going, this is who I am, and this is what's going on for me as well. I think the bit that is often missing is that ability for a line manager to hear, actually, I am really struggling. Actually, this is happening at home, and and that's taking up an awful lot of time, or that's happened, and I'm really struggling at work. And you kind of, I've sat in front of line managers before and gone, this is how I'm feeling, and this is what's going on for me. And they go, oh, okay. And actually, they don't know how to respond, and and because they're not able to respond, they don't respond, and therefore that trust kind of devolves, and that becomes really difficult, because then the next time you're having difficulty, you're not going to go to your line manager because they can't respond to you.
It's a really good point, and that I think that safety in a good occupational culture, good culture within an organization will often be the things that mean people will have conversations with those people that they feel safe to talk to. What I said earlier as well about, you asked the question, what can people do? And I said, well, you don't wait for it. One of the things I would say is that we are aware, every one of us, that around the reasons why people get stressed and feel anxious. We mentioned it briefly a moment ago, which is that lack of control. So when you're doing things within your organization that are going to remove control away from people, whether that's change within the organization, whether that's new leadership, whether that's pay reviews, because pay review time is we see lots of calls when there's pay reviews going on within organizations. That those things are happening within the organization, and yet often we still wait to see what the impact of that is. And mental health is not a suck it and see kind of situation. You have to lead from the front when it comes to managing proactively people's well-being and mental health within the workplace. So if you've got some change within the organization, program into that some support that you're going to have to give as an employer around the mental health issues that people might be experiencing.
I think that leads really nicely into Mark's question, which is there a spike in usage of EAP during certain points of the year? So you've obviously mentioned kind of pay review, so pay review and job
Okay.
review time. Is there any kind of correlation between particular times of the year? So Mark talks about maybe Christmas periods and kind of in the darker months, etc. So
That's a great question. A great
mm,
question because people will assume that people use counselling services more at Christmas than any
mm,
other time. It's a time when people have got more stress and more worry, and
mm,
it's everything from what presents to buy to relatives coming round and arguments and all of that kind of stuff. So you would imagine that that's the time that you see most calls. The
mm.
reality, it's the time that we see the least calls. There are fewer calls received by EAPs across the world at Christmas than any
Oh,
other time. And that's because people have got control around something. It means they're
mm,
focusing on something. And often we'll get calls around debt and worry and anxiety and those kinds of things. But those things are put to the side often while they're focusing on other things. Because while they've got family or relatives coming around, then they're focusing on what they need to do, what you need to buy, what presents I need. Everything else is put to one side. And they're spending money. They're not worrying about money because they're spending it. What
mm.
that means is the busiest time for an EAP is the end of January. The period that we are in now, we will see more calls, and those calls will double during the
Oh,
end of January, beginning of February. People talk about, Blue Monday and what have you, being the most difficult time. And I know that's kind of we know that, but it's true. Those are the things when all the control that people had on the lead up to Christmas, all the worries they had, the concerns they have, they all start to land again. They might have worried about it. They might not have worried about it during the Christmas time, but it's January and the debt's back there again, and
yeah.
now they've got more. So those are the times that we see busy usage. Holiday times as well, quite low. So sort of August, September into October, those times are low usage as well. It's all
Mm.
about when people aren't thinking about the things that cause them worry or anxiety. If they've got a little bit of control around something, if they're not thinking about the things that worry them, they're not picking up the phone and speaking with a counselling service.
That's really interesting because I think we often do not make an assumption that because Christmas can be a very difficult period of time, that perhaps we're doing it there. So yeah, it's interesting that actually it's not in those moments. It's a little bit further down the line.
Yeah.
So Claire, this is a good question. This is a great question, Claire. Any views on measuring organizational stress as opposed to individual stress?
Mm, that is a great question.
Mm,
So organizational stress, you would do through pulling all the data together. And I think that's one of the things that businesses get stuck on, which is they're looking at individuals and things that are
mm,
happening with individuals, and they're taking that as something that's happening for everybody throughout the whole organization. Um, I think data is really important when it comes to
mm,
well-being and mental health and putting in the services and the support that people need. It's how you collect that data. I'd ask people generally in things like this, the one-to-ones or the conversations that your managers are having with their people, what happens with that data? Is it held by that person that's had the one-to-one?
yeah.
Or is it put centrally? Because if it's put centrally, that will give you an indication as to what's happening within the organization generally, rather than focusing on one thing. And
Mm,
we do find that. So if there's and it happens, unfortunately, if there's a suicide within an organization, then
mm,
obviously that organization will do everything it can to try and find out why that happened. Was there anything they could have done to prevent it? Was there support in place? But they're focused on that individual. They're focusing on that occurrence.
mm.
And the reality is there's so much data that's available to people. And it's not just the one-to-ones, it's leavers as well. Make sure that if you're doing leaver interviews, what happens with that data? Leaver
Mm.
interviews tend to be very regimented though, you know, why are you leaving? Where are you going? Is there anything we could have done? All of that kind of stuff.
Yeah.
And then that goes into a folder, into a file, and it's never seen again. Please make sure within your organization you have somebody that's responsible for checking the data that comes from those conversations. Because if you've got that, that'll tell you what's going on within the organization, just not with individuals, or not just with individuals.
Yeah, I mean, I've certainly introduced in previous positions. I've certainly introduced when we've introduced mental health first aiders, we've almost done a bit of a not an incident form is clumsy because it's not an incident form, but a bit of just a little very short kind of 3 or 4 question form that allowed us to be able to log how many mental health conversations our mental health first aiders were having. If people were comfortable giving us their department, just purely so we could then track, do we have an issue in logistics? Do we have an issue in, support services? Is it an issue over here? And then very simply, whether something was work related or personal life related or a mix of both. And that would be all the data that we would collate. I wouldn't be able to turn around and go, oh, Karl's having an issue with X, Y, and Z or anything anywhere near that kind of interesting. But what it did was it enabled us to evidence really well that our mental health first aiders were being utilised and that people were finding them useful. And actually be able to go in and really be targeted with our wellbeing kind of from a proactive perspective. So if we knew we suddenly had a flurry of work-related mental health conversations in one specific department, we could then team up with HR and say, has there been a change in line management in there? Is there something very significant happening? And then we were really able to target in.
Staff surveys are a good thing.
Staff surveys are great, aren't they?
Yeah, because and confidentiality is a really big thing. So when you're talking with your managers or supervisors or whoever it might be around the information that they're taking, make sure that none of the information they're providing back is identifiable, and talk about that to people as well. So we're gonna do this, but I'm not going to put your name on this. So I'm just because we want to know as a business what we can do to help. We want to know what the issues are. So talk about confidentiality, and then make sure that no individual is being identified. And if they do that, I think that will help. Well, it'll help a lot, because confidentiality is a huge thing when it comes to trying to support people. Also, the other thing I would say is make sure that the people that are having those conversations are equipped with the knowledge around what is available. You speak about mental health first aiders, and they're great because they're there not to provide mental health services. So people that come into me and my team, for example, we're providing specific mental health support around whatever issue it might be. A mental health first aider is there to signpost people onto the most appropriate support. So make sure the people that are having conversations or might be spoken with by somebody within their team or the business generally, that they are equipped with either the knowledge of where somebody can go or where they can go to get that information. Because how many times has somebody thought this is something that would really benefit, an EAP is something that would really benefit this person, but they don't have the telephone number or they don't know why they might call them. And it's a lost opportunity to support somebody that actually might be in real crisis or in real need of help.
I think as well, we would be remiss to not mention the HSE stress risk assessment and the kind of the principles that they do. And I think as OSH professionals, it's useful for us to look at that at an organizational level as well. If we suddenly see that we have an increase in EAP usage, let's go back to that stress standard and figure out, is it something that we are doing as a business?
You've just really reminded me of something. So otherwise I will forget at my age. One of the things that is really important is if you have an EAP provider, and let's not forget 90% of businesses do have an EAP. not maybe standalone, but maybe as part of their insurance, or whether it's liability or indemnity or whatever it is, group life insurance, they often come with an EAP. Make sure that you're getting the data from that EAP as well. It's all aggregated, so nobody is identifiable from that data. But make sure you're talking with them about the types of issues that they're seeing within your organization and also within your sector. So if you're in a food and beverage or a training environment, what other customers have you got in that environment, and what are the things they're experiencing? Because it might be that your people aren't calling, but other businesses,
other people are.
So you can learn from what they're doing. So your suppliers are key to getting that information. So pick up the phone after this, get them in, get them on a call, and ask them what the data is that's coming from your business or from the sector.
I mean, that's amazing. I had never thought about that, because actually we learn from each other about incidents. You know, there's news articles, there's, you know, the HSE are doing some fantastic work at the minute around, you know, doing little case studies of really serious incidents that have happened and stuff. And we use that information to bring into our business and learn from it. And actually being able to do the same with mental health information, kind of mental health and wellbeing information, enables us to be much more proactive and learn from others. We have 5 minutes left, and I have a feeling that this could have the potential to go on far into the evening if we're not careful. Jeremy has a question around: how does the World Health Organization define burnout, and why is it classified as an occupational phenomenon?
Sorry. So burnout is, it isn't just occupational. Obviously, it's things that happen at home, but what we have to remember is things that happen at home impact us in the workplace, and vice versa. The reason it's put in there as occupational burnout is often around the support that employers can provide. So often there is something that can be done to alleviate the pressure being placed on an individual in the workplace, whereas at home that's much less likely. You know, the stresses that come from your home life are there, unfortunately. Whereas within the occupational environment, there is an opportunity for you as an employer to recognize it and to do something about it. So it's put in there as an occupational health burnout, because unfortunately that is the place that most support can be provided.
Yeah, I mean, burnout, I've certainly experienced burnout in my career, and for me, the experience was being working at an exceptionally stressful level for a long period of time, which had, which made me very, very unwell. And I think that's the thing is, you know, we're in the business of making sure that we're protecting people and we're looking after people and enabling somebody. Sometimes it feels like your business goes, well, as long as they're not falling over, it's okay. Yeah, we'll just let them keep going. Oh no, they've fallen over, and now there's the potential that they could be off on long-term sick. Whereas if intervention had happened, if somebody, I think that was always interesting. I certainly feel that if somebody had approached me, which I think will partly answer Jeremy's second question, I think if you do notice that one of your top performers is becoming disengaged, is not performing in the way that they have been previously, or even small things like not presenting themselves in the way that they would normally, I think having that conversation and going in a very non-judgmental way, but being able to turn around and say, I have noticed that you don't seem to be the same bubbly individual, or this, you know, you seem to be more irritable, or you seem to be, you know, quicker to be very stressed, and all of that kind of stuff. Is there anything going on? I think having those kind of very gentle interventions, rather than it immediately going to HR or immediately, you know, going to oh, we're going to throw counselling at you and all of that. Having that initial conversation and giving somebody the opportunity to go, no, everything's a bit rubbish at the minute, and work is stressing me out, and I feel like I've taken on too much, and then this is happening at home, and all of this, and being able to speak to that individual from a team and say, okay, what I can't necessarily help you with the work home stuff, but let's look at how we manage expectations. Let's look at how we manage all of these things at work and see whether we can reduce that stress.
Sometimes, just asking the question is enough.
Yeah.
And you're right, there are ways to ask people, but you have to remember, you could ask something in the best way. If you don't like talking to that person, you ain't telling
You're
them.
not going to talk to them. Yeah.
Something about burnout, just very quickly, is we did a study just before Christmas, actually, around the effect of remote working on burnout. And what we found was that people are having high levels of burnout, even though it feels like they've got a perfect ability to manage their work-life balance. And the reason for that is the status light on Teams. And people are just trying to keep that status light
keep the green light on
all the time. And the reason we did that is because the very first time I said we've got to do this study is because I contacted one of my team and I saw they were on green, and I said, "Hi mate, just wanted to check in. Where are you?" He said, "I'm on the toilet." I said, "What on earth are you answering the phone on the toilet?"
So, no.
Said, well, I just wanted you. I didn't want you to think I wasn't working. I'm like, no, please. If you were
you
in
can
the
go.
Office, you can see somebody.
See you. Yeah. Now, unfortunately, we have run out of time, as always. This is always what happens when Karl and I get talking, because I think it's evident that this is an area that we are both incredibly passionate about. Thank you so much for attending this session. Thank you so much to Karl. Take care of yourselves and each other. And thank you very much, Karl.